Hey there, it's Dr. Diaz. These are some discharge instructions for after your pet's dental procedure. So your pet today had a full cleaning under anesthesia. They were prepared before surgery with a quick exam, IV catheter, and medications, pre-op medications. During the procedure, they were monitored very closely during anesthesia by myself and one of my technicians. There were full mouth radiographs that were performed to determine if there was any disease before the gum line or under the gum line or at the root. And then our technician went ahead and scaled all of the teeth, polished them, removed any excess debris, tartar, and calculus. After cleaning and polishing, laser therapy was applied, which helps reduce inflammation and speed up the healing process. I typically give an NSAID injection at the time of the procedure to help with any soreness, inflammation, or discomfort associated with polishing below the gum line and cleaning up the teeth. If there are no extractions, I don't send any additional medications home. This NSAID injection is on board for about 12 hours to help reduce any discomfort. Now, if your pet did have extractions, I will send home the oral version of this medication. Everything's on the label, when to start it, how much to give, and how often. In addition to NSAIDs, if your pet did have extractions, a local block is applied at the time of the procedure. This will help numb the area, reduce any discomfort associated with the extraction, and that will be on board for several hours through the evening, probably wearing off by tomorrow. For cats, I also apply a long-lasting opioid medication called Zorbium. This is applied to the skin, and it provides really good pain control for about 4 days. During those days, your cat may act a little funny. Sometimes they might hide more than usual. Sometimes you might notice their pupils are a little more dilated. They aren't typically sedate, but they might act a little off for just a few days. But the important thing is that there's really good pain control on board during those 4 days, and after that period of time, it will start to wear off. In addition to those medications, all pets should have received an anti-nausea medication that you administered the night before. If they did not get that, then we provided the injectable version here today. So with that, there's 24 hours of anti-nausea effects with that medication that will help combat any nausea associated with anesthesia. So with that, you are welcome to feed tonight, later on this evening. If your pet received no extractions, then they can eat their normal food, their normal amount. Kibble is okay, or soft food if that's what you typically do. Now, if your pet did receive extractions, I typically recommend soft food for about 7 days. And so if your cat or dog normally eats hard kibble, that is okay. You can soak it in some warm water for about 20 minutes before offering it. That'll help soften it just a little bit. If your pet normally eats some canned food, then that's perfectly fine to continue. And like I said, that would be about 7 days after the procedure, and then they can eat whatever they normally do. Healing afterwards. So if there were no extractions, typically the healing process is very quick. Nothing particularly painful, maybe a little discomfort for the evening, maybe a little bit of drooling can be expected. If your pet did receive some extractions, it can be normal to see some blood-tinged drool for about 24 hours after the procedure. They might be a little bit kind of head shy, so if you do try to touch around the mouth, they might try to avoid that. However, if you're seeing excess blood or drops of blood or anything like that, definitely call us right away. A potential complication of extractions is that sometimes that pocket can open up a little bit. That doesn't happen commonly, but just be aware that is something that can happen. Not an emergency, just call us right away if you do notice something like that. For the rest of the night, your pet may be pretty sleepy, so just give them somewhere comfortable to sleep, rest, let the anesthesia kind of run its course. Be careful around stairs and keep them off of furniture so they don't accidentally fall off to the side or get hurt. Either way, if you have any questions, if you have any concerns, definitely call us the next day. Someone should call you to check in, but if you have any worries at all, definitely let us know right away. All right, thanks.